Well, I'd like to start by thanking our panelists for making themselves available for today's panel. And we have some very interesting topics for discussion. Everybody has already, or the overall organizer has introduced everybody, so we'll delve straight into the detail. So, we've heard from Paweł already in his talk, and we all understand that drug discovery is a very capital-intensive business. So I have two questions. Firstly, do you think the capital markets in Poland are sufficiently involved, the private capital markets are sufficiently evolved to be able to finance companies like Selvita? And do you also think that the availability of grant funding is sufficient, and will the private capital match that grant funding? So I'll open this to the panel, but perhaps Paweł can start.
Well, I believe that there is no lack of funding for biotech research right now in Poland. We had a different situation 5 years ago, 10 years ago. Actually, Selvita was not eligible to receive any grant funding back in 2008, 2009, because the government was telling us that our projects don't fulfill the European Union definition of innovation. So it took us 2 years of convincing, lobbying that, grants for projects like Cell24 can be granted to us. But now, the situation is different. And also with investors, we had a hard time convincing, especially institutional investors, that you can really make money by discovering new drugs. But with the success stories of Mabion, Celon Pharma, Selvita, Medical Algorithmics, and other companies on the stock exchange, I think that there is no lack of enthusiasm for the healthcare and pharmaceutical sector also among investors.
Okay. And your experience, perhaps, from the AstraZeneca perspective, how do you see this?
Well, looking at the Polish landscape, and I always give the analogy of the skiing high jump. 20 years ago, if somebody said, in 20 years you will have the world's best skiing high jump team, people would say, no way. If at that time somebody went and said, I need some money to support Adam Małysz, everybody say, no way. And then 17 years ago, Adam Małysz won. And then suddenly, 17 years later, we have, the world's best high jump team. And so I think we need more of these champions, like Paweł. Paweł is kind of the Małysz today. And I hope that in now maybe less than 17 years, but we will all mature, including the capital markets, including the public funding, to the fact that we can have a world-leading biotech team. We can have guys like Paweł. Hopefully we can clone them, and but at least Paweł has 400 people in his team. So hopefully some of them will start new companies at some stage, and they will be brave enough, to do what Paweł has done 10 years ago, and what at that time. And I remember our discussions 10 years ago, Paweł, because we discussed your ideas, and I myself am to blame for the fact that I was a skeptic at that time, to be honest. But today I think we're also in a different stage. The biotech industry, obviously in Poland, is still in the embryonal stages. But I would say with targeted, focused approaches, with a strategic focus on the biotech sector, we can get there. Not tomorrow, not in 1 year, not in 3, not in 5, but perhaps in 10, 15. But that will require really very targeted actions, like in the UK, for example, and the creation of the Life Sciences Manifesto, the Office of Life Sciences, etc.
That's interesting. So what are your experiences, and I'll open this to everybody, in attracting foreign capital to your businesses? Because clearly in the life sciences, particularly in drug discovery to a certain extent in devices, an awful lot of money is required. So ultimately, a fair proportion of this will have to come from abroad. So what are your experiences in discussions with foreign investors? Are they positive? Are they keen to invest in Poland, in your businesses? How does it look?
Okay, for us, we as a MedApp company, we are on public stock exchange and we are on New Connect. So for us, we are based on our investors, and without this support, we will not do what we want. And this is really crucial for us to have this kind of support. And right now, we see a lot of attention from abroad, from another countries, investors, and their point of vision, how to invest, is different from our Polish investors. And to be honest, Krakow, Warsaw, and Silesia became our Silicon Valley, and we know that, and we see this interest from other investors from Great Britain, from United States, even from Dubai and Emirates. We see possibility to gain investors, and we think that right now, today, this is the time when we can and we will have this kind of investors.
So one of the key things about building businesses is ultimately management. So in the West, clearly there's a lot of experience management. Investors, if you ask an investor what they think the three most important things are in investment, they'll say management, management, management. Often in Poland, investors don't like to back teams. They like to manage their investments themselves. So just opening this whole theme to the panel, what's your view on the importance of management, the attitude of investors to management, bringing in management practices from abroad? Perhaps, Agata, you can start off.
Well, I don't have much experience in this field. We are a young team in Laboratory of Biomedical Engineering in Warsaw University of Technology. We are doing our best in management, but we are studying some management, business administration. But, well, we don't have comparison in foreign managers. We don't know if we are doing it right, but it's more like we are adjusting our skills to Polish environment and Polish administration, grant applying, and managing Polish people, because I think the characteristic of action, Polish people actions is different. The Polish teams act differently. We have different environments, so it's really difficult to compare our work to foreign teams. But still, we are trying. We have our trips and try to collaborate with different teams and possess these skills and learn.
Clearly, there are huge cultural differences. It always strikes me that when you're sitting in a bar with a Polish team, everybody looks the same. We speak English very frequently, but culturally, business culture here is very different. So perhaps we can open this up to the big corporate view and then the emerging biotech. So perhaps we can start with your view on this topic.
Well, coming back to the question of teams, I think, in general, it's all about people, right? And yes, it starts with great science. Yes, it starts with, innovation. Yes, but that's a process that can be, let's say, dealt with. In the end, you need people with the passion, with the courage that, Paweł had and many others have to actually you don't need a scientist. That's I think the key thing, that you don't need a scientist to run a biotech company, because in the end, at some stage, the science stops a little bit, or it it goes on the side trail, and then you have to really focus on many other things, on getting the grants, on managing the team, on attracting teams, on talking to your investors, etc., etc. So suddenly, this whole management story, and then you have the whole people management, right? Okay, when you have a team of 5, yes, you can probably do it without many skills. When you have a team of 400 or 1,000, suddenly it becomes more challenging. And I would say, coming back to your point, Roland, I would say that maybe 20 years ago, when you looked at the multinational corporations across the board, across industries, a lot of them were managed by foreigners in Poland. I think today there's still some foreigners, but even looking at the pharma industry, there's less and less foreigners and more Poles managing these corporations. I would say the management talent as such, maybe it's not, it's not huge. I mean, it's not as experienced, it's not as well trained in the field, but I would say, the talent and the skill set is there. What we need is now the courage to actually go into something, which is completely crazy today, because it's still, if you run let's say, not a super early stage, not a discovery stage biotech, but let's say a development stage biotech, it's still very, very risky. If all goes well for Cell24 and I'm keeping my fingers crossed, still statistically, Cell24 has 1 out of 10 chances of making it to the market, statistically. So it's still a risky proposition today. So I would say, I think once we appreciate the fact that there is risk, once we learn how to manage this risk in in the way that is usually managed, which is a large portfolio of small projects, then I think we can have a good critical mass of projects, of which suddenly we will have these, Adam Małysz teams, etc., who will grow, be successful, and the snowball effect will happen.
I think you've highlighted a very good point that scientists are only scientists, and we should allow them being just scientists, and they need huge support of lawyers, managers, and to manage all this administration stuff.
Well, there is a saying that goes along the lines of a bad management team can mess up a good technology, but a good management team can make a silk purse out of a sow's ear. So maybe Paweł can quickly comment on the management and how you see it, and how, because I noticed that you have management from abroad in your business, so what prompted you to do that?
So actually we're trying to find a Polish chief scientific officer for Selvita back in 2007, but for like 6 months we couldn't find anybody who would be willing to work with us and be appropriate. So we decided to employ a foreigner, a Frenchman, who has worked with us for like 4 years. He nurtured his successor, a Polish guy who learned drug discovery, and then, he was able to take over. But without the French PhD, MBA, 10 years drug discovery expertise, Selvita wouldn't have been where we are right now. So I'm a great believer in, let's say, working with foreign managers. We have also 25 foreigners. They are bringing additional skills. They are bringing a different perspective. Because let's face it, Poland doesn't have a track record in the biotech industry. We are not as well connected in Boston, in San Francisco, as German, the Swiss, or the others. So we need to build bridges, and employing foreigners in Poland is helping with building these bridges.
Okay, interesting. One of the, changing tack slightly, one of the issues that we've seen in my business, LSBC, in terms of translation, is rather the lack of translation from academia into business. Selvita has been successful. Generally, this is a difficult topic. There's great problems with compliance, and there's also an institutional fear. Various administrators within universities and technology transfer offices, it seems to me, are frightened of commercialization. Does anyone have any comments? What could be changed? How would you address these challenges that face many universities, even if they have good technologies?
I want to return to last sentence, and this will be also answer for this question, because last time when we were in HIMSS, it was on Orlando, someone from Microsoft asked us, Mateusz, how you managed to finish this project in 3 months and give such a good quality, and it is better than quality and than other universities give us from other countries, and they work on this solution, on this kind of solution almost 8 years. And after 3 months, your team give us something which is better. And a friend of mine, Ralph Sajkiewicz from United States, give a really good sentence, because our PhDs are better than your PhDs and their PhDs. And this is a sentence from Second War, because after Second War, Eisenhower, as far as I remember, asked someone from NASA, how it is possible that your team is became to start this development to launch rocket to the moon faster than Russia. And he said, because our Germans are better than your Germans and their Germans. And this paraphrase is, we have really good scientists, really good, and they are really open. Of course, we have this some special rules in academics which are really old, and we have to change them.
Still transferring IP from university to company is difficult. In 2014, we had this novelization in law, which the aim of this novelization was to make easier for scientists to transfer their work to companies. And I think in principles, this novelization was very, very good, but we were pioneers on Warsaw University of Technology. We were the first team to go through this new path, and it was really difficult to let's say, talk with, get some answers of this difficult, for these difficult questions. But I heard that here in Krakow, the Jagiellonian University has very good history of commercialization. They've put a lot of money in patent applications for many technologies, and this is, I think, really good example.
Well, I would say maybe I can add, because yesterday we had there was a very nice discussion with Tom Weaver out of Congenica in Cambridge, UK. And he said something which struck me, because I didn't know that, but Cambridge spun out 4,500 biotechs. Okay, so there are 4,500 spin-outs from Cambridge. That's a nice number. I don't think we have that many all over Poland, ever. So it's possible to do. And I would say, I don't have the golden recipe, but there's probably two approaches. One is have excellent, but absolutely excellent tech transfer officers and specialists at universities who can actually help scientists. I don't know. From what I understand, we don't have yet an excellent cadre of tech transfer specialists. There's another way, which is empower the scientists, okay, and teach them how to do it. That's another way. So rather than centralizing at university in a tech transfer office, say, okay, here is the approach, here is how you should do it. Learn how to do, we actually send you to a course, or you do an online learning course, whatever. I don't think it's that difficult of a process, to be honest, probably. We give you the ecosystem support, and then you do it. So I think the question is how we approach. Some universities probably will approach the first way, some others the other way. I think the key is to create maybe 2 or 3 such centers of excellence where we can spit out or spin out, you know, many of these biotechs, because again, that's the critical mass that we need in this very high-risk industry.
I think one of the critical things when spinning out is to ensure that the appropriate diligence has been done with the opportunities. And ensuring that the competencies within the transfer offices are available to actually make those decisions is very, very important. I mean, certainly Cambridge, Oxford, and going over to the States, MIT, they're well-oiled machines, and I've had the pleasure of running a Cambridge startup a decade or so ago, so I know what it's like. Please.
A good example for us, I think, it could be CIC, Cambridge Innovation Center. The origin is, of course, from Boston. And you've said about these centers. CIC philosophy is about putting everyone together in one place, and because innovations are born after as a result of cooperation and interactions, and they actually measure it. They measure the possibility of effective collaboration according to the place where people sit or work. So the possibility of collaboration between people which are working in different floors in 100 is 100 times smaller than people which are based in one room. And I think in Poland, scientists not only work in different districts, buildings, but I think often in different ages.
Okay, we have just about a minute, so I'd like to ask each of you to spend 15 seconds telling me why you're working and doing what you're doing here in Poland. Starting with you.
Well, I'm a physician by education, so the medicine is somewhere in my heart, and I love doing what I am doing, and that's why this whole biotech story is so inspiring to me, because I think, in the next 10-15 years we will see a grand revolution, and really being part of history of medical breakthrough is something special.
Okay, because I love my country, this is obvious, but right now we are in the stage when our hospitals are opening, like Mayo Clinic in United States, to new technologies. We see a lot of open professors and doctors like Professor Dudek, like Warsaw University of Medical, and they are really open to this kind of new technologies. This is why I am here.
Big amount of possibilities for gain money for research, and I think my mentors.
Paweł, the last word.
After the career at Comarch or Interia, I could do what I wanted, and I wanted to do something meaningful, and curing cancer is one of the most meaningful things that you can do right now with your life, so I decided to just try to do that.
Thank you. Well, that's all we have time for. I hope you as the audience have enjoyed this panel. So I'd like to give a big hand to our panelists. Thank you very much.
Thank you.
Thank you.